Hear me?
Yeah, you can proceed.
Good. So welcome back, and we'll, as I said, change our tack completely, and hopefully this will be of interest for those who are working with patients and who have an interest in traditional medicine particularly. So I'm going to look at traditional approaches to indications and contraindications. Now, this is just one slide, but it's going to, as you say, be animated. So I'll take you through each stage as we go. So I'm looking at the way in which medicines were described in different traditions around the world and through history. And this could be in India, probably the oldest system in Ayurveda. It could be in China, in Asia generally, what we call now traditional Chinese medicine. It could be in Europe, as in Galen and the Greek traditions of Hippocrates, and then developed by the Roman physician Galen, or it could be in the later re-establishment of Galenic medicine in the Islamic Empire, with obviously Avicenna as being the main author at that time. They all were coming from different cultural backgrounds, but strangely came up with very similar approaches. And what I've done here is distill those into a very schematic view of how medicines were understood. So the first thing is that medicines were related to the assessment, we would call it now diagnosis, of the patient or the individual in front of you. And so their energies were described as either as at the extreme full energies, where they were more active and resilient, or empty energies, where they're depleted and tired. And there are various ways in which that would be understood by looking at them and looking at their energy and their story and so on. It's fairly clear if someone is high energy or not. But you can also check on things like pulses and other signs that the body can produce. So the individuals or patients were on a spectrum of being full and active and energetic on the one hand, and depleted and tired on the other. This is an important distinction because it affects very much what you can and can't do. In the case of someone who's got high energy, you would be using a more active medicine. RX is the shorthand for medicine. But you would not use that so much with someone who's very depleted. In that case, you would use something that's more nourishing, more food-like. A term we use is tonic to describe something that supports the body rather than kicks it around, so to speak. So this is an important point to make. If you're with someone who is depleted, very exhausted, not able to get the energy going, who's often fatigued and tired, then you should not use more active medicines. They don't have the resources, we say they don't have the batteries charged to deal with these, to manage these. And very often what you'll find with someone who's very depleted is if you go in there with a very strong mixture, whether it's herbal or pharmaceutical mixture, you will actually make it more troublesome, make it worse. What you need with someone who's very run down is to support and build up their strength first with nourishing tonic remedies. Important point to make. So then in the next animation here, we've got the classic four-way split, the four-way array of ways in which the energies were described in traditional medicines. And this is a summary of very distilled summary of many different traditions. There's a fifth in China, but for the purposes of this conversation, the four would be fine, because these are easily recognized as climatic, as weather related qualities. These were widely used to describe the way in which people's energies reacted, or people's constitutions reacted to different situations. So I just want to describe these each in turn. Someone who is cold or having a cold reaction to their condition is they feel cold, and their conditions get worse in cold weather, or with a cold pack, or with anything that cools them down will make their symptoms worse. They need heat to correct. It could be a headache, it could be a joint pain. If the symptom is improved with heat, then that is a cold symptom in traditional medicine. They tend to be, if they're cold, they tend to be quieter, slower in their reactions. On the tongue, the tongue will be pale, and also the nail beds will also be pale. Their complexion will be paler. It's a sign of a reduction in energies. To put it in context, anyone who has felt a dead person will know the dramatic difference there is between death and life, and the dead person is cold. And coldness was a sign of their energies being used up too much. So it was also linked to the emptiness or the depletion that we saw at the bottom there. But coldness is an active quality as well. It's a reduction in heat, and the more you get towards the death state, the quieter, the less active you get, the cooler you get. You will, if you go into a hospital or any place where sick people are, the cold people are the ones who curl up in almost like a fetal position, and who wrap themselves in blankets to keep warm, and who are quieter and less animated. That's all a sign of cold. The opposite of that is the hot. And someone who's hot is hot. Their symptoms worsen heat. They tend to need cooling. So someone who's got a hot constitution will walk into a room in Europe, where we know cold weather very well, and will be the ones to open windows and when everyone else is freezing. They are the ones who've got their natural heat bubbling up. Their symptoms will need cooling. So their headaches, instead of needing a cold pack, will need a hot pack. Instead of needing a hot pack, will need a cold pack. They tend to be more active and noisy. Their tongue is darker, their nails are darker, and their complexion is darker. And in a hospital, they'll be the ones that are throwing off the bedclothes and becoming more active and animated. And an important point to make here is that as you grow as a human being, you start by being hot, and you get cooler as you get older. So the obvious example of that is that if in children, you can't get them to sit still. I mean, imagine a child of 5 or 6 sitting for an hour listening to me. It just wouldn't happen. They'd be up and down, they'd be fidgeting, they'd be restless. That in traditional energetics means they're hotter. And as they get older, they cool down a bit. And of course, as you get very old, you cool down and eventually you die. So that idea of heat and cold was also related to the levels of activity in the body. And in terms of remedies, our remedies divide into those that are heating and those that are cooling. So you can see that immediately there is a contraindication here. So if you are a hot type, you don't want heating remedies, at least not on their own. And if you're a cold type, you don't want cooling remedies. So there's an immediate spread of indications here that if you were wise in your assessments, you would adhere to. So what are cooling remedies and what are heating remedies? Well, let's start with the heating ones. We've already talked about them. The hot spices are heating. The things that warm you up are heating. they also include things that are stimulating, that make you more active and more agitated, are heating. So you would be careful with using those with someone who had hot symptoms, as we've described here. But you would use them for people who had cold symptoms, and indeed the spices are the classic antidote to cold disease. And one of the reasons why they were so valuable was because it was Europeans who were asking for them. And in Europe, the weather is cold and damp. And before the days of central heating, winter was a miserable affair. And you got a lot of sickness in winter as a direct result of the cold. And so you were looking for things that would warm you up, and the spices do this directly. But it could be food as well. So, for example, it's always known in Central Europe that chicken, for example, is heating, and so you would have chicken soup as a heating remedy, and as a Yiddish remedy as well, very much so as an antidote to cold. This is a deep tradition that you also find in places like China, where in the classic Chinese eating places, the maitre d', the chef or whatever, would look at your tongue as you came in to looking for food, and would provide food that was cooling or heating depending on what they saw. This is useful stuff which we can still apply, and I do apply constantly in my work to differentiate between the two and not use one where you shouldn't. A similar thing with the other polarity, so the dry and the damp. The damp is the easiest one to start with, because we're very familiar with that in this part of the world, the UK and Western Europe generally. North and Western Europe are the homes of damp, particularly cold damp, and the two often combine here. But a damp condition is one that is worse than damp. So people will sometimes complain that their joint pains are worse in the damp weather, and that runs across both cold damp and hot damp. So a word for hot damp that we have is humid, which is the weather you get in near the equator and near the tropics, further south from here and from you, where you can get some really sweltering, damp, hot climate. And there's some people, myself included, who get much worse in those hot, humid combinations of damp, in that case, and heat. So dampness is about the presence of damp in the air, but it's also about the presence of damp in the body. And people knew exactly what that meant, because, as you know, if you leave, maybe it's a pair of shoes or a belt or a bag or whatever in a cupboard somewhere, you forget about them, and the cupboard is a little bit damp, you go and find them and find that there's mold on the leather in this case. And people knew that mold was basically an infection. And so in the old days, before germ theory and a modern understanding of infections, what we now call infections were called damp in the past. And dampness was the disease state that everybody understood. And in Ayurveda, the word ama is a word that accompanies almost all diseases, and ama means damp. So the notion was that dampness was the major disease-causing factor in climatic terms. So we would describe persistent infections and congested conditions of inflammatory conditions as dampness in traditional terms. You tend to have mucus, you tend to infections, there's that whole combination. So dampness combines with cold very often, and in that situation, the main remedy again is the spices, because spices, not only are they heating, but they're drying in traditional terms. So your ginger, for example, the classic hot heating and drying remedy is one of the most powerful remedies to use in cold, damp conditions. Cinnamon as a very good close companion to ginger, and the two often combine to ginger and cinnamon as a tea, for example, as a remedy, highly recommended in areas where you get cold, damp problems together. They dried out almost literally. So if you've got a classic symptom of cold and damp is congestion in the chest, mucus in the chest, bronchitis problems, and cinnamon and ginger are classic and highly recommended treatments for bronchial congestion in the lungs, where you get buildup of mucus and infections associated with that. So that's the cold and the damp. The hot and the damp, as I said, the humid thing, is actually associated much more with liver problems. And the main condition treated in traditional medicine, apart from fevers, which I'll come back to in a moment, was hepatitis. That was the most common condition in history, and hepatitis is always understood across the world as a hot, damp condition. So it's the combination of heat and dampness that seem to bear down on the liver and cause those liver bile problems. The classic treatment for hot, damp are the bitters. And they are the archetypal cooling remedies of traditional medicine, cooling and drying. So the hot spices are heating and drying, and the bitters are cooling and drying. So both of them work on damp conditions. So between the two groups, the hot spices and the cooling bitters, we have two opposing treatments for dampness, depending on whether the damp is associated with cold or with heat. Very important old lesson that we can learn. So in looking at someone who's got a congested condition, an inflammatory condition, a long-term immunological problem, for example, whether it's the joints or the lungs or the bowel, the question that a traditional practitioner would ask is this a cold problem or a hot problem? It's probably a damp problem because it's a congestion. And the way that you always confirm that in traditional medicine is to look at the tongue, because dampness is associated with coating on the tongue. Tongue diagnosis is as old as the hills. Everyone used it in traditional medicine, and it can be quite a complex thing, but it can also be quite simple. And the best way of understanding how the tongue can be read is to look at a baby's tongue. A baby's tongue it starts out by being perfect in most cases, and then it starts moving in different directions as you get older. And once you've got imprinted on your mind what a baby's tongue looks like, you can then begin to understand the different ways in which adult tongues show themselves. But the overall, one of the simplest ways of understanding a tongue is to look at whether it has a coating on it. And coating means dampness in traditional medicine. If it's a cold, damp problem, the coating tends to be white. If it's a hot, damp problem, the coating tends to be yellow and then increasingly darker colors, depending on the intensity of the problem. So those are the sort of signs that the traditional practitioner would be using. Dryness is slightly harder to get their head around, but it's a condition that's worse in dry weather, where the mucosal surfaces tend to dry, and is particularly associated with allergies, hyperreactions, immunological overactivity. It's a constitutional thing very often. So some people are born with a tendency to allergies and tend to have dry constitutions. A link to that, their tongue will be dry. There will be other signs of that dryness. But dryness is also something that's associated with aging. So people who are older tend to become drier, and the skin gets more wrinkled, and they lose some of the natural moisture in the tissues. That is another way in which dryness comes through. And we often, it was also associated with the old condition tuberculosis. Tuberculosis was a classic hot, dry condition of the past, mainly, still common in parts of the world, and coming back in some of the areas, you know, in UK and USA in particular, there are more tuberculosis reappearing again. Tuberculosis was where your mucosa was so dry you actually coughed up blood. That was how people understood it, and it was the classic case of dryness and heat together. And the herbal treatment for that was moistening remedies, like the mucilages that we talked about earlier, like saponins, like licorice is a classic moistening remedy. And you would use those as an antidote to the dry and the hot, particularly. Dry and cold is a little bit more difficult one to manage. It's associated with people who live up in the near Arctic areas, you know, where you've got that combination of dryness and cold, and you need a combination of warming and moistening in your treatments. So a sort of summary here of the way in which in traditional medicine, you would choose your medicines according to the constitution of the person you were dealing with, and you would not use a cold medicine in a cold condition or hot medicine in a hot condition, unless it was in part of a more complex management system. And you will note, again, just going back to the beginning, that I've put these cold, damp, dry, hot things near the top of that line from full to empty. The point, again, to make is that someone who's very depleted, who's very tired, doesn't want any of what I've just been talking about to start with. They just want feeding. They just want nourishing. You want to give them tonics. You want to give them adaptogens. You want to give them things that will help build up their core functions. And if you give them something that's too cold, too bitter, too dry, too hot, too spicy, the chances are you will disrupt their metabolism rather than support it. So there immediately is that priority I mentioned earlier, that if you're dealing with someone who's very fatigued, don't go into any of these active treatments in any big way. Focus much more on nourishing treatments. Okay, so then we've got just over 20 minutes for questions and answers. I'm very happy to take any questions you have, whether it's in the chat or focus through. I'll leave it up to you as to how you want to pass them over.
Simon, can you see the chat?
I can see the chat. So there was one question about comfrey, which I hope I answered to the right person, about whether comfrey can be, whether you need to mix it with other plants to make it more absorbable. And my answer was no, you don't. Comfrey is usually used on its own. You don't need anything else with it. It's a whole mixture of beneficial properties with the right sort of mucus and the right sort of tannins already in there. So it's a very good healing plant all on its own. So how can we know, is another question, how can we know which herbs containing Parisian alkaloids are safe? For example, echinacea versus coltsfoot or comfrey. Is there some kind of rule, like saturated versus unsaturated, etc.? How can I know as a herbal practitioner? Well, that's a very, very challenging question, I have to say, because in this country, the herbal community is very much divided on this. Most herbal practitioners have decided to play safe and not to prescribe remedies like comfrey internally, like coltsfoot internally, like borage internally, because they contain the prolizin alkaloids that, in theory at least, are hepatotoxic. And, you know, you can't argue with safety if there's a risk that you may be unwittingly exposing a person to danger, then it's best to back off a bit. On the other side, the chances of damage are only there if you take these herbs over a period of time. That's one of the problems as well, because we often say that one of our safety, I should have said this earlier, one of our safety assurances is that people would recognize a plant that was poisonous, because the effect short term would be fairly obvious. So they know about the arrow poisons, they know about the ones that would make you feel sick or whatever. But in the case like prolizin alkaloids, the effect only happens years later. And it's impossible really to be sure what might have led to that effect. And the fact is that liver diseases were common in the past. So we can't say that all herbs are safe in the long run. So some of us have said, let's back off, let's not argue with this. There are some cases, and the echinacea I've already mentioned, where the prolizin alkaloids are the wrong sort, and nobody seriously suggests that they are dangerous. So the ones that are of concern are the plants I mentioned, comfrey, coltsfoot, and borage are the ones that have come into the frame. So the answer briefly is if you're feeling prudent, just avoid internal use of those, at least over any long-term period. What's the next one? Question about hawthorn or crataegus. In which cases would you use the flower and leaves or the fruits, or a mixture of both? So there's two questions here. So I'll take the first one. The traditional European evidence base for hawthorn is to use the leaves and the flowers. There is also a tradition, particularly in Ireland and some parts of the UK, of using the berries. And it looks likely that the berries are pretty much as good as the flowers and leaves. But the one that is most widely used in medicine, and it's a prescription in places like Germany, is the flowers and leaves. So you could use a mix of both. You could use one or the other. Of course, if it's later in the season, you can only pick up the berries. It comes in later in the summer. Another question about using plants like Dioscorea in combination with estrogen treatment during menopause. That's a very good question, because it raises the question about what we call phytoestrogens, and I should have done a bit on this in my presentation, because people do, and this is one of these confusing stories about plants with estrogenic effect, and the idea is because they're estrogenic, you shouldn't use them in, for example, in certain cancers which are estrogen dependent, or they may interfere with hormone replacement therapy in menopause or whatever. Let's just back off a bit and just make the point that the estrogens in plants are not estrogen, as I said earlier with wild yam. They are protohormones, and their estrogenic effect is actually very weak. Now, to understand what this means is just this illustration of how a hormone works. Think of a hormone as a key, and it fits into the lock and turns the lock, and then that leads to the action of the hormone in the cell and in the tissue. So the estrogen receptor, the lock, is what actually is the important bit here. So the estrogen comes in, turns the lock, and you get an estrogenic activity. But what if the molecule, the key, is very weak? So it comes in, it still goes in the lock, but it's not strong enough to turn it. We call that a weak estrogen. And there is a drug called tamoxifen, which is used in breast cancer specifically because it is a weak estrogen, and it gets in the lock and blocks the real estrogen from having the effect. So the effect of tamoxifen is an anti-estrogen. Take it from me, because this is a very complex argument, and we've been around this for years, but the phytoestrogens are weak estrogens and are actually anti-estrogenic. So their effect is not to exacerbate estrogens, but actually to contain them. So you're quite justified in using plants like soya or linseed, flaxseed, that have a lot of phytoestrogen in them in cases like cancer, because they will reduce the impact of estrogen. Their effect in menopause is more complex, but mostly women report that they feel benefits in using these plants in menopause. And it seems to be the case that in cultures where there's high consumption of soya, like in Japan and so on, you find less menopausal symptoms associated with that. So mainly the story is reassuring, and that you can usually be quite relaxed in using plants with estrogens, phytoestrogens in them, with estrogen treatment. Excepting, however, if the estrogen medication is a critical dose, that a phytoestrogen may reduce that effect. So there's another question about comfrey. Yes, well, this is a very good question. As I said earlier, comfrey is one of my favorite, the favorite healing plant. And just to give you an example of how important it is, you can now see my hand here. Many years ago, when I was about 20, I cut my hand open with a glass, and I could see the bone underneath. And I was just about to take myself off to get stitched up. And I was already learning about herbs, and I thought, no, hang about, I've got comfrey, let's see if it works as well as it should. So I made a comfrey pack and packed it on to that cut, and the result is there's no scar. And I sometimes have to remind myself which hand it was, because there's no difference in them. Comfrey is amazing in speeding up the repair of tissues, and scar happens when the repair is slowed down. So you can reduce scarring by using comfrey. And as I said earlier, it's also used for in speeding up the repair of tissues underneath the skin. And that's because the active agent moves very quickly, allantoin, and moves very quickly through the skin and moves through the body, in fact, very quickly. So putting it on the skin gives a really healing effect. But something I also learned was that one of the ingredients of comfrey is this type of mucilage combined with tannins that is really very strong. It's the sort of thing you put around glass and window frames, is what we call putty. It's very strong, constricting, solidifying material as it dries. And I made the mistake once of getting the leaf and decided to make a juice with the leaf. So I put it through a juicer and started pushing the leaves through the juicer, and went through. But after a while, and nothing was coming out the other end, and suddenly the motor seized up, and I took the lid off, and the contents of the container was solidly packed with this very solid material, which had burst open with the fresh leaf. And it's that, I think, which helps to pack and seal and bring together the wounds. So for that, the fresh leaf is really good. And so I would recommend that you find comfrey if you can. It's very easy to grow. It proliferates very quickly. But to get fresh leaf and make yourself packs for repairing tissue. So another question, if I understand correctly, high quality black cohosh isn't potentially problematic in the liver, and I would say yes, that is true. And we've made the point at the highest levels of regulatory control, and quietly they have agreed with us, but because they can't easily control the supply of black cohosh, the general advice is still to be careful with black cohosh as a potential risk. But the reality is that it's not Actaea racemosa that is the problem. It's adulterants. So feel, if you got a good supply and you know it's the right plant, feel quite comfortable using it. It's a very good remedy for women particularly, but also for inflammation. It's often used, it was used by the Native American populations for things like joint pain and rheumatism and inflammation, also of the bowel. So it's an anti-inflammatory remedy as well as a hormonal one. Very, very useful. Any other questions?
שאלות חברים? Simon, in your opinion, how safe is Cratagus when it combined with hard drugs?
Heart drugs?
Hard drug, yeah, Cratagus, Southern.
Well, you need to be careful here because someone who's on heart drugs is relatively sick, you know, and you need to be careful, particularly if you're in a shop environment, you know, you're dealing with a consumer, you're not having a chance really to understand their needs. And so if you're not very close to the situation, probably the simplest thing to do is not to interfere and not to be careful about anything you give for someone who's on a heart treatment, because clearly that could go wrong. Having said that, if I'm dealing with a patient, and I'm in my practice room now, if I'm dealing with a patient who's got a heart problem, I will usually be quite happy to use Hawthorn Cratagus alongside it, but I would be watching things carefully and checking in with them and their treatment, and going gently as well, particularly if they were in quite serious problem, because Hawthorn, when used properly, can be really effective for heart disease, and it doesn't clash with things like digoxin. It seems to support the heart drugs in many ways. Certainly works very well with beta blockers, which are often used for heart disease. It seems to complement them very well. But, you know, I make the point, it depends on how close you can get to that person. And I would be careful about making sweeping recommendations if you don't know the person very well.
Of course. And you spoke about curcuma longa. You are using the whole rhizome, or you are working only with the curcumin?
No. How long have we got? I have written articles, and sometimes I'm called Mr. Turmeric at Pukka because I'm the turmeric specialist, and I have a yellow waistcoat when I talk about turmeric. My argument is that the main effects of turmeric are in the gut, because curcumin is very, very poorly absorbed. Only about 1 or 2% of curcumin gets into the tissues. However, curcumin is very powerful ingredient, and there are many ways in which it works on the gut surface. And I've argued and written about this a lot, that the main anti-inflammatory effects of turmeric are indirect from its effects on reducing inflammatory markers on the gut wall. So for me, I go back to history and I go to India, where they have turmeric with every meal of the day. And the average Indian is having 3, 4, 5 grams of turmeric every day. And I think most of us are turmeric depleted. We don't have enough turmeric for our modern needs. And I would say, if we don't want curry every day and every meal, the best thing to do is take a supplement of turmeric. And all I would be interested in is getting as much in as I could. So I would take a supplement with a high concentrate of or extract of turmeric, but I wouldn't be worried too much about a high curcumin. Now, my colleague Kerry Bone is sold on high curcumin, so he and I are slightly different. But for me, taking turmeric as a supplement on a regular basis, if you've got any inflammatory problems, is a very good place to start.
Okay, and another one, can you clarify what you said about the use of ginseng and hypertension? I want to understand that I want to make sure I understand what you said before.
There was, ginseng became very popular in New York in the 1980s. And it was all part of the very zappy lifestyle that New Yorkers tend to lead. And so they were using ginseng basically as a way of, you know, giving a kick, giving a lift, giving it as a stimulant. And something called ginseng abuse syndrome was reported in the literature. And it was seen that ginseng was raised blood pressure and did all sorts of stimulating activities. When you dig into that storyline, you find that actually the problem was that the dosaging was inappropriate, but more that they were combining ginseng with caffeine, and they were having ginseng and coffee, and the two together tend to be double their stimulating effect. So the main ginseng abuse syndrome problem was probably ginseng with caffeine. And then that turns it into a stimulant, and you can then get blood pressure problems. But if you take ginseng appropriately, you don't get blood pressure problems.
You speak about Panax ginseng, the Renshen, not the Eleutherococcus.
That's indeed so. Eleutherococcus, which is Siberian ginseng, we call it, is much more calming than Renshen or Panax ginseng. But even Panax ginseng is not a stimulant. It's more, in my slide earlier, it is more to the one that you'd use as a tonic for someone who is depleted. And it's a convalescent, as a recovery remedy. So you'd use it for someone who was at low energy to build them up. You might, to use that previous illustration, you might not want to use ginseng so much if they were very hyper.
Sure, of course, yeah. So a weak person with high blood pressure, you have no problem to give, no problem.
None at all.
Interesting.
No, if they're low energy, if they're fatigued, if they're tired, but they happen to have high blood pressure, then that's a different mechanism. And I would definitely go in with adaptogens like ginseng quite happily.
Very interesting. This is new for me. Okay.
Good.
Yeah. Okay.
There's a question here about dosage. I see on my chat. Opinion about different schools of opinion about dosage, and all I can say is help. Both Kerry and I are high dosage people, and that tends to come from experience a bit, because I've been doing this for a long time, and I'm tired of waiting. I want to get stuck in. So my usual request to a patient is to ring me tomorrow, because I'm already expecting something to happen, because I want to, get stuck in. So I've lost patience with low dosing. I want to get stuck in, and Kerry is of the same opinion, and also the two things. Traditional use tended to be higher dosing, and clinical research tends to involve higher doses. So when you get into lower doses, you're getting into something that's much more under the counter, much more supportive behind the scenes. If you're dealing with someone who's very fatigued or depleted, then I would reduce the dose and start with a very low dose and maybe build it up once you were confident. But no, I tend to be go for the high doses, but I also know that there are many traditions, including in Europe, where they have low dosing and combinations of low dose. And there's even an approach called nanopharmacology, where you have such low doses that you're almost homeopathic, where the impact of the herbs is very subtle. There's different approaches for different situations. So
for instance, if I understand, you're using tincture basically?
Mostly.
And high doses, if we have like a 3 or 4 herbs formula, is like 10 milliliter 3 times per day. And we are speaking about a concentration of 1 on 3 or 1 on 2. This is basically high doses.
Yeah, the ones you see behind me are actually MediHerb from Australia, and they're usually 1 and 2s.
1 and 2.
So they're pretty concentrated, and that's where you can whack in the dosing. And one of my private joys is to ask the patient to take the herbs in front of me so I can watch their face. And it's always, wow.
Especially wormwood.
Yes, especially wormwood or andrographis, you know, it's so bitter. But to see the immediate impact of some of these herbs is all, you know, the thing, you can feel it happening. So I like that.
Okay. 1 second, חברים, עוד שאלות, זו הזדמנות אחרונה. Simon, thank you so much. It was a very enriching lecture. Really appreciate your time, and hopefully we will see you soon, maybe in Israel.
I have to say that I'm not a foreigner, but my time in your part of the world was on the other side of the river. I was a young child in Amman.
Oh.
And hung out with Crown Prince Hassan. He's of my era. We went to school together. My father was teaching English. So I spent weekends in East Jerusalem, of course, in places like Na'רך and other parts of Jericho. So I love that part of the world. So I would love to come back at some point, see you.
Your side. Invite you.
So thank you so much, and see you, Simon.
Shalom.
Bye. Thank you so much.
Okay. Bye now.
Bye-bye.